Hello, good morning, good afternoon, good evening, depending on when you see this. Alcohol. We will talk about it. Um, of course, we will go over psychopharmacology. We will also look at neurochemical effects, which is very important. You've been wondering, why aren't we talking about the drugs yet? Well, now we know. We will integrate everything with neurochemical effects, which we'll have for every major substance that we discuss, and alcohol use disorder. Firstly, alcohol, after caffeine, is most commonly used as a psychoactive drug affecting our thoughts, feelings, and behaviors. It can be beer, wine, mead, excuse me. Originally, it was used to even fight things like botulism and gin, as I was told. Whatever the case, we had all kinds of portrayals of alcohol with poverty and social stigma for a while, especially in European Western cultures. We had a prohibition, which we talked about last time, and we tried to see if we could stop it, but we had people who were medicine um, kind of experts posing um, not genuine and selling all kinds of tonics. The latest kind of thing similar to it is Herbalife. It's been studied by the government right now under investigations. They say it's natural-ish and that it prevents diseases, and it even can help to heal, not necessarily cure, but make better some things. And we're looking at how valid and legitimate all of that is. So what is it? Ethyl alcohol, ethanol, um, and methyl alcohol. The reason it's called intoxication is because it has all kinds of effects on your body. Um, Originally, we have carbon organic formations. Anything that's organic has a carbon in it. And alcohol has hydrogens and oxygens as well. Through fermentation of sugar by yeast, even at room temperature-ish, you can grow such things, including takju, makgeolli, rice, wine, um, beer. Some people distill their own beer, fermenting it. Um, Above 15, the yeast dies. Distillation increases alcohol concentrations and produces much stronger alcohols and liqueurs. At any rate, it doesn't really have vitamins and minerals, proteins for nutritional value. Part of the issue is that when you drink chronically and intensely, you don't have enough nutrition, and your vitamin B, which fights stress, decreases significantly and considerably, and you need it even in your brain. It's highly reactive because of its molecular chemical component, as you just saw, and it will absorb through our gastrointestinal tract into our bloodstreams throughout our bodies, entering our tissues and our brain. We call it blood alcohol content rather than how much did you drink, like not 6 glasses versus the actual BAC is measured. One serving is generally seen as 5 ounces of wine, 6 ounces of beer, 1.5 ounces of spirits, 12 ounces of a wine cooler. And the volume versus the actual BAC are adjusted for how much alcohol is actually in it. And each can have a different alcohol volume. Vodka has more than beer. If your stomach has food in it, it will absorb more slowly. There are gender differences. It takes active men a little bit less time to process it because of their enzyme called alcohol dehydrogenase. So women have a little bit more to be absorbed quicker in women. And aspirin inhibits the enzyme. So you might notice women get affected a little bit easier, as common speak of lightweight. Again, there are individual differences, always. Alcohol passes through passive diffusion, 95% metabolized by the liver, some excreted in the lungs, and 5% remaining, which is measured BAC and breathalyzer field sobriety exams for forensics. Alcohol dehydrogenase converts the alcohol to acetyl acetaldehyde. 10% of genes, Asians have genes for an inactive form of it. So we get the Asian flush known as redness here. So we have to be a little bit careful about accusing certain people of certain things based on diversity and culture. They might be less prone toward being able to process and be alcoholic. Induction is with regular use of alcohol, the enzyme increases, which means the rate of metabolizing alcohol and other drugs can also increase metabolic tolerance. Heavy use causes cirrhosis of the liver, and this is a horrific disease. So you can look up the BAC according to your own weight. And it's not simple. We actually need this chart because even though you might be one thing at one point, you might gain weight. And so, and your tolerance can shift and you drink more. Tolerance meaning how much effect the alcohol has on you. Cross tolerance is when you have multiple drugs. So what are the mechanisms for tolerance? Acute tolerance, single exposure to alcohol can mean that you need more to get the same effects in your body and experience and perceptions next time. Metabolic tolerance, increase in P450 enzyme in the liver. Pharmacodynamic tolerance, continued presence of alcohol, changes in cellular function, neurons actually adapt to it. Behavioral tolerance, you're under the influence of alcohol, but you adjust and you compensate. And physical dependence, where you actually have withdrawal symptoms if you do not take the alcohol. Cross dependence, you take multiple substances with withdrawal symptoms if you don't take them. Hangovers are withdrawal. So what happens is your brain shrinks away from the skull. The skull is 3 thin layers of relatively harder matter on top to protect the gelatinous brain inside. And without enough water, you tend to get dehydrated and a little bit of shrinkage. It really happens. You might have tremors, shakes. You might have anxiety, rapid heartbeat, sweating, nausea, vomiting, DTs. This anxious feeling of high blood pressure and heart rate are known as delirium tremens. When you're actually dependent on the alcohol, it can feel like a massive panic attack, convulsions, high blood pressure, disorientation, hallucinations. Culture is a big component, social component. If everyone says alcohol of wine and champagne for New Year's Eve is a fancy schmancy thing, then we act a certain way. If we say this will grow hair on your chest, I don't remember which alcohol that is, but then we act a little bit more aggressive and so on. We do have decreased libido. After many, many drinks, you can have difficulty with erectile functioning as a possibility, but there are individual differences. What happens? Relaxation, less anxiety, social inhibition will decrease. You will be more extroverted, talkative, gregarious, and your judgment and decision making will decrease. And we'll talk about why. What is a blackout? Complete and utter amnesia for what happened. So I knew somebody with borderline personality disorder when she was in high school. Early diagnosis, provisional, because she was having strange symptoms. She blacked out, was drunk, hit a car, did a hit and run, and had no remorse or guilt about it. She considered it partying of the rich. But she had a blackout for that entire episode. Your psychomotor control will decrease. You will be discoordinated and you will be more emotional. You might know emotional drunks who cry or say I love you to everybody. In terms of car accidents, they changed the BAC count to 0.808 instead of 0.1 because of alcohol-related accidents, especially during Friday and Saturday nights. As you can see, age does make a difference, as with generally substances. When your frontal cortex is clearer to full neuroanatomical development, you have more self-regulation of the other parts of your brain to control your impulsivity, and you also have control over your behaviors better at age 25 to 28. This behavioral disinhibition from alcohol, shutting down your frontal cortex, relatively speaking, decreasing activation in it, can also relate to acts of aggression and crime. High doses can even lead to death, loss of consciousness. Alcohol poisoning includes vomiting to get the toxin out, irregular breathing, clamminess, bluish skin, cold, and these are the symptoms for the different BACs. Brain damage can happen. I saw a patient at San Francisco General Hospital and Laguna Honda Hospital where I did internship, and they had permanent schizophrenia because we have ventricles of cerebral spinal fluid called salt water in our brain. Our brain is masked in it. And it is bigger and bigger and bigger in this region because the cell of the brain is actually dying, the cells. And so her temporal cortex suffered. And she was not able to process information coming in auditorily and get it out. So we would give her a 3-stage command: fold the paper, set it on its lap, and put it on the floor, and she wouldn't be able to follow. And then she would want to say something and she'd say fork, but she meant pen. And this is because her boss was very hard on her. She was a major, mega, multi-tens of millionaire CEO, and she loved the position, so she did it, but she didn't like her boss, and she would go home and drink to make his self-medicate to make his social and emotional verbal abuse go away. And she drank chronically, which means long-term, and intensely, which means a lot. So she did brain damage to herself, and it's permanent, and then she has schizophrenia, and she has thoughts that are not based on reality, delusions because of it. We already talked about the vitamin. Wernicke's is what I'm talking about, where it's difficult to speak. Korsakoff syndrome is memory loss, amnesia, some hallucinations, personality changes. Confabulation means you have two facts and you can't stick them together because you forgot, so you make up the middle. You make up the connection. That's confabulation. So the thalamic nuclei are part of your thalamus, which relates to pretty much everything in your brain, suffers, and that's because of the vitamin B deficiency, B1 and related thiamine. They go together. We can give you lots of thiamine and vitamin B, but it's not going to recover enough usually in such a situation. So we already talked about all of this. And these are the beautiful butterfly ventricles I was talking about. You see this? This is a normal cerebral spinal fluid salt water. I think I said your brain is basked in it. And this is the alcoholic bigger one. Other organs are also in your central nervous system affected. Blood vessels can start to feel warm, but you're actually losing heat. Dilation of vessels in your brain. We talked about all this. It can help with reducing bad fats and helping with good fats in very, very minor to moderate dosages. Your liver, because it metabolizes the alcohol first, the fat will remain longer. So it's called fatty liver. Alcohol-induced hepatitis, damage due to death of liver cells. Alcohol-induced cirrhosis of the liver. I think Trump's older brother had this. I could be wrong. At any rate, scar formation because of all the alcohol being processed. Alcohol gets oxygen cut off then because of the scars, and the blood can't get to it as easily. It's irreversible. You don't need to memorize all this. Endoplasmic reticulum, different types of cellular damage to the liver. Fetal alcohol syndrome is where the Centers for Disease Control and Medicine say there's no amount of alcohol that is considered safe for a pregnant woman at any point in her pregnancy. The idea is that the child can end up with physical and genetic difficulties from prenatal exposure in the womb. So they have low birth rate, failure to thrive, and intellectual and developmental delays, neurological problems, craniofacial malformities such as widened certain upper facial features, abnormal undescended testes, kidney development failure, abnormal fingers and toes. You can see here the abnormalities right here that I was talking about. Mental retardation can also be an effect. Acetaldehyde, can be toxic. Don't spend too much time on the animal studies. We are doing our best to see if we can transfer the knowledge to humans based on research results. Alcohol can cross the blood-brain barrier. Most things do not pass our medulla. We are very careful to keep our brain safe from all the other things we put into our bodies. But because it gets through, it affects a few things. And here's where we integrate everything you had to learn before. I know you were dying to get to know about the drugs. Well, this is why we need the building blocks to have fun, the fundamental building blocks. Glutamate is excitatory. It makes all the energy go in our cells, but even our brain cells are not working. They are inhibited by alcohol. That's right. So then we're not paying attention, we're not learning, we're not remembering as well. What does that mean? Our hippocampus relaxes. Our hippo does what? Our hippo remembers. Our hippocampus is not remembering everything very well. That's why you wake up in the morning and you have to go, oh, did I? You call up your friend. What happened last night? At least in the movies I saw. Temporary inhibition of NMDA. So It can last even 10 hours. This disinhibition of our brain is part of why some people try to get women, let's say, a Tinder or whatever it is, they meet at a bar at night, and the woman's disinhibition is expected from alcohol ingestion to potentially have a psychosexual situation. GABA is inhibitory. It makes the other parts of your brain not do certain things, and this alcohol mimics GABA. It increases GABA release. So then what happens? You act impulsive. Someone might be jumping on a table doing dancing. I think there was a movie about a bunch of women who were bartendresses jumping on the table dancing. Dopamine, your reward center, yes. Alcohol actually makes this go, and so then you have, yay, pleasurable feelings. This is called the VTA, ventral tegmental. Oh, it's not here. Well, then I won't test you on it. Okay, at any rate, opioids, yes, alcohol suppresses pain. Just like an opioid, it increases that production and release, so you end up having less pain, called dysphoria. This could explain why in animal studies they keep trying to get more of it. Alcohol use disorder is complex. It's biopsychosocial and even genetic in its psychopharmacological specificity. It can be expensive financially, for health, and other costs, such as divorce, socially. Binge drinking is 5 or more drinks in a row for men, 4 or more for women. This is often for final exams week in colleges, for kegger parties, if they have such a thing. What is that thing called? There's something with a funnel, and people drink beer through a funnel. I can't remember what it's called, but at any rate, that would be a binge. Type 1 or 2 category of alcohol abusers. The first is drinking later in life and having some remorse. The second is more on males. It's risk-taking, earlier in age of onset, more about criminal antisocial behaviors. Barber in 1992 looked at biopsychosocial approaches to these two types in 34,000 alcohol-dependent individuals and found the typologies to be valid. And this describes what they are. 10% of Americans have some problem with alcohol use. 15 million adults dependent on alcohol. Who and what they look like is anybody. It's a human with an alcohol problem. It's a who, not a what. And whomever belongs in that is just another person who deserves every ounce of respect and individual appreciation as anyone else. Of course, one of the major symptoms of alcoholism is denial. And so only 1% might believe they have a problem when you ask college students with increasing risk. But here's an issue for injuries and death from overdose. If you say to someone, do you believe you have a drinking problem? And they say no, that's actually a marker of having a drinking problem. If you ask them and they say, oh, well, since you asked me, now I have to actually think about that. Let me think for a minute. Someone once said to me that I looked like I was so tired I was drunk. Is that what you mean? When they're actually processing it and considering it as a possibility, then they're not alcoholics. So that's the irony. At any rate, for college students, you should take a look at this because this relates to what all of this has to do with you. Did you miss school because of alcohol-related problem? Anything at all? You were hungover. You went to bed too late drinking, so you missed class the next morning. Did you get behind in your schoolwork because of it? You know, your friend said, let's go get a beer. And you're like, but I have to study 4 chapters, but you go get the beer. Let's be truthful. Look at these numbers. 42, 45 women and men. 31, 34% women and men. National Institute on Alcohol Abuse and Alcoholism says underage drinking should be focused on starting before the age of 13 and other risks for alcohol problems in the future. We have synaptic pruning, which is really important. Our brain just thrives and thrives and thrives in growing neurotransmitters and neurons, and then it cuts back a little bit. Otherwise, it would just be too much as we get older in developmental age. And because of these sensitive windows of neural development and timing, we need to not disrupt it, basically. Psychological factors can overlap with all the other types of factors. Do you have stress? Do you need to relieve tension? This can be one of the issues of alcohol consumption. Your amygdala has too much anxiety, so you self-medicate. Family history. Did your family deal with stress by drinking alcohol? That's another one. Often in television movies, especially even family ones, they say, oh, I had a hard day. I need a drink before I even start to talk to my family. This is actually not the most effective way of dealing with stress. Some people like novelty and risk-taking. I'll try anything. And they say this is a sign of higher intelligence. Well, anything that's healthy and proactive, you might say, right? Pro-social. At any rate, genetic markers 3 to 7 times greater risk for alcohol use disorder in close relatives of someone who is alcohol dependent. Like I mentioned with the child, with a parent with alcohol issues, has a high risk for having alcoholism in his adulthood. Linkage studies look at inheritance patterns of genes using DNA analysis and occurrence of alcohol use disorder in large numbers of families. When they looked at GWAS for markers, they found alcohol dehydrogenase gene clusters have a significance. Some societies drink alcohol in public. In Las Vegas, Nevada, you can carry alcohol on the streets, on the sidewalks, in alcohol open containers. Most other places in the USA don't let you do that. We can give benzodiazepines such as chlordiazepoxide, Librium, or Valium, known as diazepam, to prevent alcohol symptoms of withdrawal, which are behavioral and physical symptoms from not having repeated ingestion or use of alcohol. Psychosocial rehab is an example of Alcoholics Anonymous or individual and group therapy, or even transitional residential treatment facility houses where alcohol is not present. Many people say, as a patient, their first question is, did you abuse? And if the therapist says no, they say, are you an addict? And if the clinician says no, they want a different clinician because there's nothing like it. And that's just how it is. I'm sure some people will not mention it or present it a different way, but I think unless you've directly been touched by it, like your father was an alcoholic, you have the genes or whatever it is, you are going to have a little bit more challenge making that human connection with somebody who is considering himself or herself to have a major disorder with it. Cognitive behavioral therapy and community reinforcement approaches include psychopharmacotherapeutic. This is what I practice, so it's got the word psycho in front of it as well. We have therapy plus medication plus physicians plus whatever we need to help reinforce the positivity. So antabuse disulfiram is essentially something that makes you nauseous or even vomit if you take alcohol. We give this to people who really, 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 really need to stop. They might die or something, right? Naltrexone, because they might really have a serious problem, we give them the antabuse. Naltrexone is an opioid receptor antagonist. It's rare to give, reduces consumption and cravings. You don't have to memorize all of these, but there's a receptor modulator, nalmefene, acamprosate. I'm not sure I'm pronouncing this. It's rare. It blocks glutamate during alcohol withdrawal. Corticotropin releasing factor antagonist, because intoxication and withdrawal increases CRF receptors in the amygdala, which is your emotional center. We have other ways to try to make this stop. That's it for this one. We will go on to the next one in a different segment. Please make sure you follow along with your readings as we progress.